Hello and welcome once again to Moorgate Andrology. Now, today we're going to talk about penis enlargement surgery and the post-operative recovery process. And I want to sort of guide you through some key steps that you're going to need to think about after you've had this operation. Now, the first thing is when you've had penis enlargement surgery, this is usually a day case procedure. That means that you come in, you have the surgery, you go home on the same day. But because you will have had a general anesthetic, it's really important that you have someone to come to the hospital and take you home. They'll need to come to the hospital and report to reception and take you home in a car. It's really important that you do not travel home alone after having penis enlargement surgery. Someone will need to come and collect you. If this is not possible, then we are able to arrange an overnight stay at the hospital. So someone is with you the first 24 hours. And this is really important. When you get home, you should have someone with you for the first 24 hours after the operation. Now, when you get home, you'll find that you have some medication to take. This is usually a course of antibiotics and also some pain relief medication. It's really important that you take the antibiotics and take the full course, even if you're feeling better. It's really important that you finish the course of antibiotics. These help prevent any infection or reduce the risk of infection. Penis enlargement surgery is not really a painful procedure. Most patients are able to tolerate the discomfort afterwards, but we give you pain relief medication, so it helps during the first week or two. Now, the second thing you're going to have to think of is some time off work. So you'll need to book some time off work depending on the type of work that you do. So, for example, if you have a sedentary job, then most patients are good with 2 to 3 days off work, and they're able to go back to work after this amount of time. If your job is quite physical, then you may need to take up to a week off. The key here is to listen to your body and don't push things too far. It's a good idea also before the surgery is to nip to the shops and have some spare pain relief medications such as paracetamol in stock, maybe some spare dressings, just so if you need them, you have these at home readily available. Also, it's really important that you follow the post-operative instructions. You'll be given a list of post-operative instructions to follow after you've had the surgery. And it's really important that you stick with them. They're not too onerous, but in following them will ensure that you have the fastest and safest recovery possible. In the first 6 weeks after penis enlargement, you will need to avoid the gym, any sporting activity, and also any sexual activity. It takes 6 weeks for everything to settle down. So this is really important. If you push these things too early, you can compromise the results of the surgery. Also, you'll have a series of follow-up checks to do with your urologist. Usually these are 1 or 2 video consultations just to check in the first few weeks after the surgery. And then at about 6 weeks, an appointment will be made for you to come to the hospital to have a physical checkup, just to check everything and answer any further questions that you've got. So there is some monitoring in the first 6 weeks, and it's really important that you keep those appointments so we can keep on top of things, can reassure you, answer any questions you've got, and so on. So follow these tips, and we don't feel you will go far wrong. A couple of other things. It's very important to stop smoking if you can 6 weeks after the surgery. First of all, smoking can increase the risk of infection and delay wound healing. So if you can stop the 6 weeks after surgery, it's really useful. And also avoid alcohol for the time that you're taking the antibiotics. So there we are. That's all from me for now. We'll look forward to seeing you back here at Moorgate Andrology very soon. But until then, bye for now.